I'm Howson. I'm the innovation lead for the Bevan Commission, and alongside the Welsh Government and wider stakeholders from across Wales, we have developed the Planned Care Innovation Programme, which will look to support the transformation of planned care services in Wales. Welcome to the first information briefing session. Over the next, hour, we will look to give you a broad overview of the programme, as Helen suggested, and answer any questions or queries you might have. So a bit of an agenda and overview of what we'll be talking about in the session. So Helen's already alluded to the role of the Bevan Commission, but I'll give you a fleeting overview of that and the exemplars programme in which this programme is based. I'll then move on to giving you a bit of a background and context to the Planned Care Innovation Programme before moving further in depth, to explore the detail of the Planned Care Innovation Programme related to the programme criteria, the programme themes, the programme funding, timelines, and then, as suggested, we'll move on to answer any questions or queries you have. At this point, I think it might be worth us alluding to directing you to look at the guidance as well, which offers more in-depth details. And if you do have any questions throughout the next half an hour session, please do write them down, and we'll come to you after we've presented this brief overview. So to start, what is the Bevan Commission? So the Bevan Commission is led by our Bevan Commissioners, who are experts from across health and social care in Wales, the UK, and further beyond, from places such as America and the States, through our Commissioner, Professor Don Berwick, which you might know. The Commission was established in 2008 to observe, interpret, analyse, scrutinise, advise and comment on health-related matters in Wales. So our role now is to provide independent authoritative advice on issues related to health and care, both in Wales, UK and internationally. And this is fed into stakeholders from across Wales, the Welsh Government and stakeholders more internationally. So as Helen suggested, we have a number of outputs, and one of our most recent papers, which aligns with the planned care challenges we face at the moment, is Doing Things Differently, which looks at tackling the backlog in the aftermath of COVID-19. So alongside the papers and the policy, one of the Commission's key aims is to work with stakeholders from within the health and social care system in Wales to transform health and care services. We do this in order to ensure that Wales has a prudent and fit health and care system that's fit for serving the needs of its future generations. So as Helen has alluded to already as well, over the past 5 or 6 years, we are now in the 7th cohort, and the Commission has translated this thinking and theory into practice by supporting health and care professionals across Wales, which we term Bevan Exemplars through our Bevan Exemplar programme, to try out and test new innovative projects and prudent ideas in live service delivery settings, and bring back that evidence for which we can then take up and hopefully spread. To date, so as I said, we are now cohort 7. The Bevan Commission, through its Exemplars programme, has supported over 250 different projects from across both health and social care. This has included industry partners, third sector partners, and local authorities as well. As Helen again has alluded to, almost stealing my thunder, previous cohorts have consistently demonstrated over an 80% project success rate. So that's developing the idea and testing it in live service delivery settings. The projects, these 250 exemplar projects that we've discussed before, span a wide and diverse range of specialisms related to planned care and further afield. So examples include very much community-based services, so transforming the way community services are operated and delivered, but also the more clinical side of surgery, respiratory care, so on and so forth. So moving on to the planned care programme and looking at the definition of planned care. I know planned care is really quite hard to define because it's such a broad sort of spectrum of services and different options for health and social care. But for this, we use the Welsh Government's definition, which says any treatment that doesn't happen as an emergency and usually involves a pre-arranged appointment. as we'll come on to, this also expands to reducing that need for treatment or different appointments. So in terms of background and context to the programme, as you all know, pressures from the COVID-19 pandemic have built upon other challenges already facing the delivery of planned care services across Wales. So there are a number of these challenges, obviously, but two main ones include the growing treatment backlog and increasing patient waiting times. But I also think there's a big one around public expectations as well, and managing that. So this fundamentally highlights a need to rebalance both capacity and demand for elective or planned care services across Wales. This effectively highlights a real requirement for significant change, both in community settings, but both as well as health and social care systems. So this need for transformational change and new ways of doing things, new ways of thinking has been widely recognised in the national policy arena. Specifically related to planned care, we can look at the Welsh Government's programme for planned care. We can also look at NHS Wales's outpatient strategy. And more broadly, looking at the system as a whole, we can then refer to A Healthier Wales, which also highlights the need for transformation, and it's the Welsh Government's long-term strategy on health and care. So, developing innovative and sustainable ways of working within across a number of different domains related to planned care services, as well as social care, local government and third sector, obviously, will play a critically important role in supporting the ambitions that are outlined in each of these strategies and the Welsh Government policies. So as suggested in partnership with the Welsh Government and wider stakeholders across Wales, the Planned Care Innovation Programme has been developed to support that transformational approach to planned care services in Wales. So the Planned Care Innovation Programme will fund and support projects from across the spectrum of health and social care, critically to develop, apply and test new ways of working. So these these projects would look at those that have the potential to positively transform or impact planned care pathways in Wales, but also those that aim to reduce or alleviate the demand in the community on planned care services right across Wales. So, as Helen's alluded to again, the programme is structured and modelled on the successful Bevan Exemplars programme, which has been run over the last 7 years and now we're on its 7th cohort, having included a really fast-track 6-month programme for COVID-19 projects. At the moment, the Planned Care Innovation Programme will not support specifically the adoption of innovation projects. However, this might be an iteration in the future. Although if opportunities arise within the duration of the programme, we would obviously be looking to develop them and push them out and share them across different health boards and different local authorities, social care, so on and so forth. So along with the opportunity to apply to the Planned Care Innovation Programme Fund, which is a £1 million fund, the programme will provide successful applicants with a range of different mechanisms, tools and support to allow them to try out and test their innovation projects in delivery settings. The programme will provide a comprehensive package of knowledge and skills development opportunities, as the Bevan Exemplars does. And this is mediated through a range and a series of network events and knowledge development workshops. Alongside this, modelled on the Bevan Exemplars, participants will also be allocated or assigned to a coach or mentor. So these will be experienced leaders from across health and social care who will be able to share their knowledge and provide a sounding board, and also just walk them through and support them on their journey throughout the 12-month Planned Care Innovation Programme. So moving into the detail and the applicant criteria. So the programme is open to applications from stakeholders from a broad spectrum of planned care services. So this could be primary, secondary or tertiary care domains, but also community, social care and third sector organisations. As well, we'll move on to industry partners as well. So I think an important aspect of this is non-NHS organisations submitting projects need and must demonstrate strong partnerships with NHS Wales health boards or trusts. As part of this application process, all stakeholders, all applicants will be required to identify support and approval from NHS Wales executive leads and an NHS Wales innovation lead. So this ensures that support from the health board is forthcoming, but it also, one of the major ambitions of the programme is to bring everyone together, integrate across different borders, different boundaries, different organisations. So we're working together on a pan-Wales scale to transform these planned care services. So in terms of the specific application criteria, so projects will be required to demonstrate a number of different aspects. So firstly, projects must be deliverable within the 12-month programme duration. So this includes evaluation of the effective intervention. So within their project, they must specify how their project will be delivered within the 12 months, but also how it will be evaluated within those 12 months. So projects must also demonstrate an innovative nature. We quite often see probably projects towards the more improvement basis, but we're looking for innovative projects, and we're looking for you to describe how this is innovative and how it's new within the context. We'd also love to see potential and ambition for innovation projects to be upscaled, spread and adopted. So here we're looking at sustainable approaches moving forward. We don't want these to sit on the shelf and get dusty. These projects will be invested in, so we don't want to waste that resource. We want to understand how these projects can be further spread to provide that wider value across Wales. We're also really keen to understand and involve integrated approaches at local, regional and national levels. These could be between different sectors of organisations, different health boards, different collaborative partners within a local area. But we're really looking to promote that cross-organisational or multidisciplinary partnership approach. So different ideas from different perspectives and different experiences are brought together to bring together that more holistic project and that more holistic approach to developing these new ideas. We'd also love to see patient or service user driven or informed approaches where this is appropriate. As you know, the patients, the ultimate users of most of these projects, so having them developed and weaved in throughout, using their experience and knowledge of the sector, understanding their challenges they may face when encompassing planned care services is critical when designing new systems and services to deliver health and social care services. So we'd love to see that, and that would be a really important thing to express across your applications. So alongside the programme criteria that has been described in the previous slides, the project proposals are also required to align with one or more of the programme sub-themes. These are drawn from the Welsh Government's programme for planned care, as well as the NHS Wales outpatient strategy. We'd also like you to demonstrate how your projects align with the 5 prudent principles as well. So the first theme relates to effective referrals. So projects that are put into this or aligning with this theme will ensure that appropriate referral guidance, mechanisms and thresholds are in place. And by doing so, we hope that this guarantees that those in greatest need are effectively referred to the most appropriate care setting, whether that's planned care services or community-based services, to ensure the demand is reduced, but also people are getting the most effective care possible. Our second theme looks at improving advice, guidance and support. So projects that might fall under this theme would aim to improve access to high quality advice, guidance and support to enable both informed decision making for individuals as well as health and care professionals. So this could take a variety of forms. Advice, guidance and support obviously takes a wide range of forms. So we'd ask you to start looking outside the box, think differently, and understand how we can do things more effectively and more efficiently in this way. The third theme that we ask for applications under is treat accordingly. So this is a really important one, obviously, and projects sitting under this theme would aim to develop innovative, high quality, prudent models of care. So this might be models that are based in the community, closer to home, or in traditional care settings. And these should express and understand how we can make the use of all available skills and resources. The fourth theme would be follow up prudently. So we know that many of the follow-ups across NHS Wales are often unnecessary. People are asked to come to hospital for an unnecessary appointment that could be done in another way. And that would reduce waste and resources and often produce increased value for patients. So projects aligning this theme would look to provide more prudent solutions to patient follow-up. This might be through means such as virtual follow-up, but also including sort of mechanisms such as self-management and self-care support approaches. And this aims to give individuals and patients more choice and control of their own care. And the final theme would be measure what's appropriate. We all know metrics are hard to get right in health and care settings. But these are crucial to providing the evidence and the base for which we act upon. So projects aligning with this theme would aim to transform the way we measure both demand and care to better meet the clinical needs of the patient. But I think it's important here to understand as well that we're not just meeting the clinical needs. We're talking about the wider health and prosperity of the service user. So we're looking more at their well-being as well, included under this theme, and this is alluded to more in the programme guidance. So moving on to looking at the funding available for projects to apply for, as suggested earlier, projects will be able to apply for a share of the Welsh Government's Planned Care Innovation Fund, which goes up to £1 million to support proposals. Funding decisions for this £1 million Planned Care Innovation Programme Fund will be made through the Programme Steering Group, consistent with the criteria set out today and in more detail in the Programme Guidance document. So again, I would refer you to that to go through. These are all available on the website as well. So funding will be allocated in a proportionate manner according to what the selection will see as project need, the criteria, have they met the criteria, and the impact and value this potentially is seen to bring. Funding will be allocated flexibly, and what we envisage, although there is no definite pots like this, we envisage that there will be small, medium, and larger funding streams. So obviously lesser projects with a higher amount of money, and then as you come down, you get more projects asking for a smaller amount of money. So importantly, I think to stress here is that what we've found through our exemplars is that innovation doesn't necessarily need funding. So projects might also apply to be part of the Planned Care Innovation Programme as a non-funded participant. This would allow them access to the knowledge and skills development opportunities through the networks and workshop events put on by the Bevan Commission and wider partners. So funding will not be allocated to projects solely looking to support staff costs for existing interventions. Existing interventions is key here. We know that the workforce is struggling in many aspects of health and social care, and this project part is not designed to just bring more workforce that do the same to fill those gaps. And finally, funding recipients will, as expected, be required to submit quarterly reports on how they're using their funding to the Bevan Commission, which will then be reported to the Welsh Government. So just a bit of advice and guidance on what the sort of application process might look like. So we'd first encourage you to read the programme guidance document, where possible, as you all are, attend the information briefing session where we hope to be able to answer your questions. We'd then really encourage you, as suggested before, to discuss your project with your local innovation lead. In the application, you'll be asked to specify whether you have support from your local innovation lead. So this is a really critical point. We then ask you to draft your application. So there's an application template form on the website which you can access. So this can be used to draft your application. But the online form should be used to submit your final application. So the online submission form, again, can be found on the Bevan Commission website. And the deadline for submissions is the 15th of February 2022, which I know will come around very quickly. So get those conversations started. Applications from us will then be sent to your local innovation leads for approval. So hence, developing this, co-creating this with your innovation leads is a critical part of this process. Applications which are then approved by your health board will be submitted back to us and submitted to a selection panel, which is made up of experts from across health and social care in Wales and beyond, and key members of the steering group. From this, obviously, outcomes of the programme selection panel will then be communicated more broadly. So just to give you a quick overview of what the timelines look for this. So as Helen alluded to before, the programme was announced at Planned Care Summit on the 4th of November 2021. The call for applications opened on the 29th of November 2021, and the call for applications closes on the 15th of February 2022. We very much know this is a tricky time. We've got Christmas in between, we've got COVID-19 kicking off at the moment. So we've tried to extend the application window to as late as we can to align with Welsh Government timelines effectively. The programme selection panel will then take place on the 28th of February before the programme starts in late March 2022 and will conclude in March 2023. As with all the Bevan exemplars, cohorts and programmes that have gone before, participants will then be given the opportunity to celebrate the success effectively and present the outcomes of their project at the programme showcase in July 2023. So now it's over to you. Come and join us on the journey. We've seen over the past 7 years, we've seen some incredible projects that have produced unbelievable value, and I'd like to say most people on the exemplars programme have really enjoyed it and gained a lot of experience and knowledge in doing so.